Hi everyone, hello from Liverpool. For today's episode of Rosé with Roots, we've got a really wonderful person who I met quite recently, and she has been helping IMGs and new doctors, and that's how we started having a conversation. This is Dr. Sai or Dr. Yuva Ravindran, whatever you prefer. She is an IMT trainee in the West Midlands. She graduated from India, did her internship there, and is currently the BMA regional chair. She's also the well-being representative for her trust. And she organized a really lovely national BAPIO conference for doctors. And she helps new doctors find their way, get into training, and basically just provides guidance through her website called To the NHS. And she also has a WhatsApp group. So a lot of things that Yuva is doing, and we're just gonna have a chat about IMT training because I get a lot of questions about it, and my knowledge is very limited. So I've got an expert who's in training, so who will answer. Hi, how are you?
Hi, I'm fine. Thank you. That was a really nice introduction. And yeah, we'll
Should we
start.
start? Yeah. Okay. So I usually with young people and people like us who've just joined medicine. So why did you choose medicine? And if you have any interesting stories.
Okay, so regarding joining MBBS itself, I did my MBBS from India. So I've always wanted to do that, and that's what I liked, and that's what I did. And when I started, or before I started, I had like maybe in high school or like in the beginning of first year or during first year, I had different interests. Like I wanted to do surgery or OG because from the outside it sounded very different. Like, as a school girl, I was like, oh, surgery is so nice. And like that's what I wanted to do. And then from, all of us, from the second year of medical school, we had clinical exposure. But when I went there and when I had chances to go into OTs, and then when I had chances to go for the medical ward rounds and all of that, I changed, or I found that I align more with the medical people than the surgical people. And then I was by end of second year, or like by middle of second year, I was sure that I can only do medicine and surgery is not my side. And I tried to explore like, non-clinical stuff like pathology, microbiology, and all of that. In India, it was really nice, and they all have like a very good work-life balance. But it was very interesting, but I didn't think I could do it like for a long time. And yeah, so medicine was very interesting for me because when we started, it was all new and everything was complicated. And for medicine, always they had like 10 differential diagnoses. So yeah, so I think that made me, and I think for me, according to me, for surgery, I think you need like a lot of patience and a lot of skills. But for medicine, I think it's a lot of reading, and I felt it's more like being Sherlock Holmes, like trying to be a detective and say, this can be this, but it cannot be this. And then, no, I don't think that can even be that. So it was like that. But surgery, I thought, was a more skill based field, and I suck at skills. So just delete it.
I
So, yeah.
agree completely. That's such a great analogy that we're basically Sherlock Holmes and we love solving puzzles. And that's why internal medicine or medicine as a
Mhm.
subspecialty
Mm.
interests us so much. So, yeah, that's like the,
Yeah. And the
yeah.
author of Sherlock Holmes is a physician. So, not surprised.
Yeah, we're the brainiac.
Yeah.
Okay. So can you tell me a bit about the process of getting into IMT training?
I have, before I came to the UK, like in my college, I studied in a private medical college, and I was the first applicant to the GMC. So from when I started, I had to dig through everything and find out how to do it. Like, what is the procedure for that, and what is the procedure for this, and all of that. So even while I was in my medical school, I kind of did a research, or like I Googled about what is PG in the UK and all of that. So I knew about IMT back then, internal medicine training, but I think back then it was called core medical training because it was just for 2 years, but now they've made it for 3 years and it's called internal medicine training. And entering it, basically, the process is very long, but the minimum eligibility is that you need to get your crest form signed or your competency signed off. So I was very focused on that. I got it signed. And then as soon as I think I came to UK in November and like the year before, and I applied for IMT that year. I mean, the applications were in November that year. I think I came and then I applied it for like in 4 or 5 days, and then the applications closed. And then I got shortlisted and we had an interview, and then you give your preferences. That's how it was. When I applied then, like honestly, it was just, I was not at all convinced, or I was not expecting anything out of it, because I just came. I mean, I think it was 1 week of coming to UK or starting in the UK. So I was like, fine, even if we fail terribly, at least I know what the process is like. So I will just give it. So I think that's what I tell whoever asks me also. Even if you don't have a portfolio, even if you don't know what the interview is going to be, you think you're not prepared, just apply for it. So you at least know what the process is. But there's another thing as well. Retrospectively, now I wouldn't recommend doctors to straight away jump into IMT1. I think you don't have to be an F2, or you don't have to be a non-trainee for 2 or 3 years, but I think at least 2 to 3 months of how the NHS is like, or at least 2 to 3 months of on-calls and doing independent ward rounds is important before you become a trainee doctor.
I agree. So it's similar for me. In November, I arrived like a couple of months ago. I literally arrived
Mm-hmm.
and started working in November, and that's when applications were opening.
Yeah, yeah.
So I applied nonetheless because I wanted to know what the MSRA is like. For
Mm-hmm.
IMT, there is no MSRA, but for other specialties,
Yeah.
for instance, I'm interested in emergency medicine and interventional radiology. So for these specialties and a lot more, there is MSRA. So I wanted to know what it's like, what the exam is like, because we've never really given
Mm-hmm.
uh, an SJT, like an ethics-based exam,
Yeah,
which is quite interesting. So yeah,
yeah.
I definitely agree with it. If you've arrived, if you have the opportunity, do apply, see what
Mm.
it's like. And I would recommend working for a little while as well, because
Yeah.
everyone tells you the system is different, the system is different, but you only realize how different it is when you
Yeah.
actually start
Mm.
working here.
For me, like back home, all my consultants, most of them, at least like 8 out of 10, were CCTs from UK. So the practice was not different for me. It was the way they think, the way they prescribe, it was all very similar. But still, NHS itself is very different. Like they have a lot of follow-ups, they have a lot of other systems. And I think if you're like a non-trainee, you're allowed to make mistakes. I mean, even if you're a trainee, you can, but as a trainee, they expect you to be more responsible or to know the system better. And I don't think, because, and again, as a trainee, I don't think if there's any shadowing, or if you can ask that you don't want to do on calls or you want to do them later. Because IMT, when I started, I think it was August 2nd or something, like when we initially started.
Yeah.
That day we had induction, and one of the other IMT ones, the induction was from 9 to 5. We've just come to a new hospital. We don't have logins. We don't have anything. That was from 9 to 5. And at 5 o'clock, he had to go for his long day.
All right, that's
So,
a big
yeah.
jump.
And we didn't have logins. We didn't know where ED is. We didn't know where AMU is. Or any. It was like from 9 to 5, it was an induction in the medical, so in the study area. And then and he was like, I got my rota and I'm on long days today. I'm like, no, you can't do long days today. You don't have anything.
Now they were just like, go figure it out.
Yeah, and he said, yeah, I think so too. And when we asked, they said, it's fine. There should be registrars there. You can just go at least help them. And then he did his long day, like his 4 days of long day. So
Yeah.
I think as if you're in training, it's like they just, it, again, when you enter into training, that's what you mean when you get signed off as competencies. It says that you're able to function within the NHS. So I think they would expect you to do that.
I
So,
think the pressure is more. In
hmm,
non-training, you have a bit of time to settle in.
yeah,
Uh,
yeah.
there is a lot more guidance. I think
Mm,
in non-training, in terms of they know you're new and they know it,
mm,
that automatically makes you a little unsure of what you're doing, because you
mm,
don't know what the referrals are like and whatever, whatever. So
mm,
there is that leeway that's given to you where it's like,
yeah,
okay, you are new. We
yeah.
understand that you don't know the system.
Mm.
So they will explain it back to you. I think, as you mentioned, when you're in training, you're expected to know it already, which is tough.
Yeah, yeah, yeah. And again, the other thing is when you're in non-training, you can go at your own pace. Like if 2 weeks of shadowing is not okay for you, you can say, no, I'm not sure. I want to do like maybe 1 more week or 2 more weeks. In training, even that 2 weeks is not very possible. But if you're like, I'm completely new to the UK, I need this week of shadowing or something, they will give you that, obviously. They should. And then I think you should pick up within that time. You can't keep extending that, or you can't keep saying that, no, I'm not still comfortable with on calls. So it's like, just go start working. And again, like, you're like an ST1 level. So they expect you to be an ST1.
Yeah. Yeah. The level of responsibility, the
Yeah.
expectancies is a lot
Yeah.
more. So now that we've discussed that it is
Yeah.
a hard job, can you tell me what you've learned, some of your experiences from IMT training?
Oh, it's stuck. Sorry, it was stuck a little bit.
Am I back?
Yes, yes.
So we've discussed like it's a difficult job. But can you tell me about some of the experiences that you've gained and what you've learned during IMT training?
Yeah, sure. And again, initially, I will not say that it's a difficult job if you know what you're doing.
Right.
So it should be, I will say it's not a job for a fresher.
Mm-hmm.
That's how I would keep it. But again, you can just learn the system in 1 month. It's up to you. Or
Mm-hmm.
you may take 1 year to learn it. So
Right.
if you're sure, like, I know what's happening, I know how this is, just again, if you come, like, let's say you come in October and the training applications are open in November, you've got an idea of how it is like, just go for it. So that's it. And in IMT, before IMT, I did not have like proper medical jobs. I've done medical jobs in India, but in the UK, I was based in very specialized departments like hematology and oncology. So I did not have like medical covers.
Like a general
Here,
medicine sort of.
yeah. So previously I was in a tertiary hospital, like it was a very specialized hem-onc center. So my on-calls, everything was just based on hem and onc. And like, it was a very big hospital. So there was no gen med cover for us. We were just based on departments. But now as an IMT, you've got gen med cover. And it is nice because you get enough general medicine exposure. Although you rotate in different departments, you're mostly clerking. So clerking is, again, when you admit a patient, when you do all the history, that's what they say as clerking in the UK. So whenever you get a lot of time for clerking, you get a lot of time for medical on call. So your medical exposure is a lot. And you will automatically, I don't think you have to, if you're in training, you will, I mean, you will automatically learn what is needed to be learned, because the rota or the system is like that. So I think and again, if you're interested in medicine, if you know what you want to do, if you know you want to do medicine or some medical specialty, I would highly recommend you to go through IMT than directly applying for ST4. You can, because some of the doctors come from India, or like from outside of UK, finishing their MD or post graduation and try and sit for ST4. But if you go through the IMT pathway, like, it's very organized, it's very regularized. So they've got before you start your first year, they give you the list of what is required for first year. So you know what you have to do, and this is what is expected out of you. And then that happens for every year. So when you apply for ST4, you know what you have to get out of ST3 to be eligible for ST4. So that would be like an automatic process. But I think if you're applying from outside, like a non-trainee into ST4, nobody's going to tell you this is what is required. And
Right.
you need to figure out all of that. Yeah.
Exactly. Like it's very organized. There are competencies
Yeah.
that you need to meet.
Yeah.
It's very structured. So those
Yeah.
are the advantages of doing IMT here and starting from the beginning.
Yeah.
Um,
And as an IMT, again, there are like the IMT post is a regional post. So sometimes it's deanery based. It's mostly deanery based, but they can still rotate you within the region. So you will not be, there are some jobs where you stay in the same hospital for 2 years, but most of the jobs you keep rotating between the hospitals, which is again very, very similar to specialty training. And I think when you rotate between the hospitals, you get exposures of different hospitals, different doctors, different people. And again, that would be very helpful in your specialty. But if you're like a non-trainee, you're staying in one hospital for 2 years, you'd be very comfortable there. You know which medreg is approachable, which consultant is approachable, which person you just stay away from, and you know the system there. And if you enter into specialty training, you will have to learn all of this as an ST4. Again, ST4 is very high responsibility. So it's
right.
just, I think maybe entering into training is getting very hard, but I think if you have entered into it, just go for it.
That's really good advice, because I think that rotational aspect of it makes it valuable, because you see a
Mm.
different sort of patient. Every hospital has their
Mm.
own unique way of doing things, even though
Yeah.
it is a blanket NHS system.
Yeah, yeah, yeah.
So
Mm.
it I think that is another advantage of having
Mm.
the rotational training in IMT. Moving on. So one of the major tasks that need to be completed while you're in IMT or preparing to enter training is the MRCP, the Royal College exam. Do you have can you give us an idea of how you started preparing and what your journey was like to get through the exam?
So for IMT to get, so for the IMT selection process is 3 stages. First, eligibility is quest form, so forget it. That's, you need it for as an eligibility criteria. That's not what you need to get an IMT post. So you need that to apply. So once you start applying, there are 3 stages. First is the portfolio. You need to get shortlisted, and for the portfolio, you need a lot of stuff to be done. And then it's the interview, and then it's the ranking. So you need to get your portfolio done, get shortlisted there, and then you'll have an interview. In the interview, there are 2 stages to that. One is, the first stage is you need to clear the interview, which is called appointable, and the other one is not appointable. So if you're not appointable, go back, start from the beginning. But if you're appointable, again, if you're appointable, that doesn't mean you've got a job. They release rankings, and the total number of IMT jobs in the UK is 1,500. So any rank less than 2,000 is okay, is good, because not, there are 1,500 jobs, but some people apply for multiple specialties, so they don't, like, not everyone who got a seat is going to apply for a job. So if it's less than 2,000, you definitely get a job, IMT job, but we don't know where that can be. And if your rank is like less than 1,000, it's 1,500, it's really good, because the total number of seats is 1,500. You're definitely going to get an IMT job.
Yeah.
So that's how it is. So MRCP, I think previously it was there as a criteria, but no longer it's in your portfolio. I think for surgery, you need MRCS Part A, and there's scores for that. But they've taken off MRCP as a scoring system for the portfolio. So you don't need it to enter into IMT. But again, if you're a non-trainee, if you've got time, again, as a non-trainee, no one's going to tell you, or like, there's no mandatory thing that you need to get signed off to, continue your job. So when you have time, I would highly just recommend you to start reading for whichever exam you want to, not just MRCP. It's MRCS or MRC Psych or whatever. Start reading for it and clear it. And the general advice is 4 months for one exam. So whatever, 1-2 paces, whatever, 4 months for one exam, and then make it a really regular, and just do the question banks. That's it. Nobody sits in, from what I know, from the IMTs that I know, and from what I did as well, none of us read the text. We just jump into the questions. Initially, all whatever you do will be wrong. Like if you did 10 questions, 7 may be wrong, but that's fine, because you've got like 1,000 questions. You have to just make sure that as you go, it's getting better. And the questions are highly repetitive. So you can either choose past medicine or past test or whichever you want. That doesn't matter. But just make sure that you're doing at least 90% of the questions. If you've done all of them, then definitely you'll pass. So yeah.
It's the same as you prepare for your like PLAB 1, where
Yeah.
you have question banks to go through,
Yeah.
and you initially feel horrible because you're getting
Yeah.
everything wrong. But
Yeah.
as you've mentioned, the idea is to improve. So
Yeah.
your graph has to be going up, and that's the way to study from question banks.
Yeah. And I think for PLAB one, you've got some time to read about, like, the PLAB notes or what the questions can be. But I think in MRCP, if you're going to sit and read, anyway, we won't know anything. So like if you want to read all the syndromes, read all the, the drugs causing side effects, you will forever be reading, and you can't finish it in 4 months. So it's just 4 months. Keep your deadline as 4 months, maybe 5 months, because maybe you'll take 1 month to get into the process, and then just go for it. So start with the question banks, keep doing it. If you finish any question bank, past medicine or past test, you just have to, if you finish it twice, then you'll definitely pass. So yeah.
Right, right. So we've
If you
covered.
don't finish it twice, it's fine, but at least you should have finished it once. So that's the basic criteria. If you have not even completed it once, then I don't think, yeah, yeah.
Um, So yeah, so we've covered some of the resources. You mentioned past medicine and past test, and you've mentioned it's with internal medicine because it's so vast. It's very hard to read the notes because, as you
Yeah.
mentioned, you'll just keep reading forever.
Yeah.
So it's more about active learning and testing the knowledge.
Mm.
Um, can you give me a few tips on balancing work with preparing for
Oh God.
MRCP?
I think again, like I said, just if it is for the exam, if you're asking for like work versus exam, then like I said, 4 months, try to finish everything in 3 months, keep the last 1 month for revision. And those 3 months, you need to make your own timetable. But if you feel you can't do 3 months, then maybe, like I said, keep it for 5 months. So 4 months to study and 1 month for revision. And this is what the general rule is: 50 questions if you're on normal days, 100 questions if you're off. So if you stick to that, then it's done.
Right. So that's a really good plan. So the tip is have a bit of flexibility in terms of
Yeah, so
providing.
like when you do on calls, you cannot even read anything.
Yeah.
So you can have your past medicine and past tests on your phones and maybe do like 10 questions when you're free or anything. But I never study during on calls, but I compensated during the offs when you get offs after the on call. So like I said, if it's a normal day, you have to do 50 questions. If it's an off day, it has to be a minimum of 100. So it's 4,000, 5,000 questions. So if it's like 100, then it's like 40 days, which is 1 month. So it's not
Right.
very difficult.
It's
Yeah.
it's very doable. It's a
Hmm.
exam that's doable if you have a plan and
Yeah.
if you sort of figure out what works best for you.
Yeah. I think the only hard part is consistency, because you'll start very well and you might be going like in a very good speed. But then if you break it off in between, then you may not start again. But you just have to make sure that you're reading every day. Maybe one day or other day you're not reading, that's fine. But every other day you just have to at least, see that and let osmosis
Push
help.
yourself, push yourself
Yeah.
to stay consistent. It's hard.
Yeah.
Yeah. So we've covered IMT training, we've covered the exam. Can you tell me a bit about building your portfolio for getting into the training?
So whoever is seeing this video, if you're in medical school, start building your portfolio in medical school, because that's the best time. That's when I did it. You don't have a job, you don't have on calls. I know you have exams, but still, I know how you study for exams also, because I know how I studied for my exams. You have a lot of time. So if you're there, just sit and work on your portfolios, and that's the best time. You can just get everything signed off. I mean, most of whatever you can during those times. But even otherwise, even if you're even not in the UK yet, if you're in non-training, all those times I would say, because portfolio is essential, try and work on that. And then if you have time, you can sit for MRCP. I kind of do both, but it's like you don't have a lot of time. So maybe if you have 1 year, keep the first 6 months for portfolio, the second 6 months for exams. Or if you don't want to do exams now, you just want to focus on the portfolio, just do that. Because even if you've done MRCP 1, 2 paces, but if your portfolio score is not high, then you won't get shortlisted.
Mhm.
So that is also equally important.
Right.
So
That's good advice. So start early, start when
yeah,
you're in med school. And I think just to add on to that, when you're in med school, you know your professors, you know who to
yeah.
approach for, say, if you need to get teaching done or if you want to get research done. So it's easier. When you come to the UK, you're starting from scratch. So it takes
Mm.
you some time to figure out who's in charge of what, who can I talk to, who'll understand my plan. You do have an educational supervisor, but it just takes a little bit more time to settle and start
Yeah.
building your portfolio. So,
And the other thing in general is like in UK, things take time. Like if you want to do a teaching, you can't start it tomorrow.
yeah.
Like you can't make a plan on Saturday and then say, okay, I'm gonna make a plan for teaching for third year students and I'm gonna start it from Monday. Blah, blah, blah. What? Hello, who are you? So
Yeah, there
right,
is a
yeah,
procedure to be followed. There are a lot
yeah,
of procedures here to be
yeah,
followed to do a lot of little things, which
yeah,
back home is very easy. Like it's even very easy to gather students to
yeah,
here it takes time. You have to figure out their schedules, your schedule. So,
yeah,
best advice ever, start early.
yeah.
And
And the other thing is, I think nowadays people are finding it very difficult to land in a job. I think that's okay, because even when I was applying, it was hard. I think anyone who has applied to UK, it has not been easy, if not for like many years back. But now, even when we were applying for it, it wasn't easy. Like, I mean, there was a huge competition. There were so many numbers. And of course, it's increasing in the recent years. But I think while you're waiting for a job, don't sit at home.
Mhm.
Like, at least go for like a GP clinic, like an outpatient clinic, and try to do an audit there. Try to do teachings in your medical school, or like you should have any medical college or medical hospital which is close to you. You can go there and deliver teaching and do whatever you're doing. So I think that is one more very important thing I would like to say. Until you've gotten your flight ticket, until you've gotten your visa or anything, don't stop working on yourself.
Right, right. I definitely agree with this. Like, keep improving yourself, even when
Hmm.
you're looking for non-training jobs. Think about
Yeah.
what you're going to need for training, because
Hmm.
it's hard, it's a long, tough process, but you can at
Hmm.
least use that time to your
Hmm.
advantage.
Yeah.
The last thing, so Yuva does help a lot of people with building their portfolio. So, do you want to talk about your website and your WhatsApp groups?
Yeah, sure. So I have been I had this WhatsApp group like, I think maybe before COVID came, since then. And then in between, I thought I will properly organize a website where I could store the videos, store the interactions, and provide mocks and all of that. So I've got that. So whatever videos or whatever sessions I do, do it through the link to
Mhm.
my website. And I mean, everything is completely free. And then most of the doctors also wanted a WhatsApp group for like day-to-day conversations. So we've got the WhatsApp group as well. And in regards to portfolio and IMT and like generally functioning in the UK as an IMG, I try and put reels, or I try and give information through like Instagram and WhatsApp. So if any of you want anything, like feel free to contact me.
I'll
I
add
again,
all
I
of
may not
those
be
in the
sorry.
we do all of her socials, all of her
Yeah.
website, her WhatsApp group, all of it is going to be down. So take a look, get in touch with her. She's very good. She has a lot of experience. She's wonderful at helping people. So
But
yeah.
I may, if you send me a message today, I may reply after a week.
Yes,
Or
bear
after
that in mind. We're all
2 weeks.
very busy.
Yeah.
You'll probably not get instant replies, but we will get
Yeah.
to.
Yeah. So that's how we train you to function in the NHS.
Yeah, we're
Yeah.
preparing you for how
Yeah.
strict things are. Yeah. So that's, I think, all of the questions I wanted to ask you. Is there anything else you want to just end with? Any advice, tips, anything for?
Yeah, so in regards to just IMT and portfolio, I would just have like a one quick advice before this ends. I would say if you're working on your portfolio, you need audits. Teaching, just do something for teaching and get that done. You need audit, presentations, and publications. My easiest advice would be to do a very good quip and then present it in a national or international meeting, publish the same quip, so you're done. So that's how if it's just like 7 things that you need, don't try and do one for each of it. Try to be smart and then just get the points. So it's all about, if you like doing it, if you're like a very research person or like a very quick kind of person, keep doing how many ever you want. But if it's just for this course, just try and do it in a smart way. So
Right,
so you
exactly.
can do that, and then so once you've got like a one very good quip done, you can keep that aside and start focusing on other things like publishing it or preparing for your exams like that. Instead of just doing, okay, I've got a quip, now I need to do a presentation, I need to find a topic for that. So instead of doing it, do it like many things in one way.
So be efficient, work smart. Uh,
Yeah, yeah.
Print out the things that you need, go through it, figure out what you're missing, and just work smart rather than just blindly working for it.
Yeah.
Because a lot of you would probably still be applying for non-training jobs, and that takes time as well. So be smart about where you can build your
Mm.
portfolio, how you can build it. So yeah, that's solid advice. Thank you for joining me.
That's okay. And again, yeah, I know that non-training is very competitive, and IMT ranks are out last week and it has become, oh my God, it's like it's up there.
Yeah.
So I think I read somewhere 76 out of 80. That total score is 80 for the interview. So someone got 76 out of 80 and the rank is 496.
Oh wow.
So I understand it's getting very competitive, but I mean, don't let that dishearten you or anything, because if you're working on yourself, if you're constantly improving yourself, then obviously your chances will come. And like, obviously, at one point, you will be in a position that you deserve to be in. So if you fail in your interview this time, or if you don't get a training job, or if you applied for 100 or 200 jobs, you're still waiting an interview, that's all right. Because all of us are.
Yeah.
It's not like you're not efficient or you are less better than others. But I would just say, yeah, this is again one very, very important thing that I wanted to tell people. Do not focus on getting a portfolio ready. Do not focus on entering into training. Focus on learning the subject. Focus on improving yourself. Focus on liking medicine, or like, you know, do what you do in a very good way or in a best way. And the chances will automatically come to you if you're the best.
Exactly. I think this is the best way to end it. Do what you
Yeah,
love, figure out if
yeah,
you love it, and
yeah,
you will be successful. So
yeah,
don't focus on the competition ratios, the number of people applying, and
exactly.
everything. It's always going to be there. It's always going to
Yeah,
be competitive. You're in medicine. Competition runs in our veins.
I know.
But
Like, too late to make a difference. I mean, if you can still,
yeah.
if you want to, but for me, it's too late to make a different choice. So,
Now you are in it. You gotta step
yeah,
into it. But yeah, it's been lovely chatting with you. I
yeah,
will put
you too.
ways to connect with Yuva and all of the amazing things she's doing. And if you have any questions, feel free to get in touch. Thank you for joining me.
It's
It's
okay.
been wonderful, and we will see you in the next episode.
Yeah, sure. And have fun as well.
You too. Bye bye.
Bye.